homework that your child brings home takes forever to finish, okay? You're sitting there at the table, you're helping your child with their homework, and they're just like, not getting it. And you're like, well, look at it. It's right here. It's right here. And so you wind up frustrated, losing patience, okay? And even at our house, we had people that would be crying at the supper table, okay? Or, you have a visual processing disorder, because reading is fun, right? Okay, it's a good thing to do. No? Okay, we need to talk. Yeah, reading is fun. It takes you to a whole different dimension, space, whatever. And so if you don't read for fun, there's a possibility you may have a visual processing disorder. Okay. When your child's having problems reading, what things do you look for? Okay. They drop out small words. So I've seen it a million times where the child will be reading mother, but they will say mom. Okay. Or they will be looking through and they'll skip a D or a not or an and or an or whatever. But you put the word rhinoceros in front of them, woohoo! And they can get that every time. So sometimes they'll fill in words that are not there, and the classic is you teach them this word up here in this paragraph. It says pony, okay? And then they read pony in the second paragraph, and they look at it, and they're like, I've never seen this before in my whole entire life. You're like, oh, it was right here in the first paragraph. It's right here, pony, okay? Here it is down here, pony. And they still don't recognize it, okay? Ooh, that's a problem, okay? So your child has difficulty even putting their thoughts on paper. Now you can talk to them, okay? And they can tell you a beautiful, wonderful story. But when they try to put it on paper, it just doesn't make the connection from here down through your hand and do whatever, okay? Another classic is spelling. Oh, my child is a good speller. They make A's in spelling all the time. Well, great. That's wonderful. So you learn those words, and then the teacher says, spell any. You turn on the tape recorder, A-N-Y. Okay? Spell D. Turn on the tape recorder, T-H-E. Okay? And then it gets more difficult. The classic thing is the next week, when they're using that word in a paragraph, and they can't spell it correctly, have they really learned how to spell that word? Probably not. They learned how to spell it for the test, but they've not internalized it to them yet, and they can't spell it later. Okay? Okay, another classic is your child can read easily in the early grades, okay? But later, usually third grade and beyond, that's when they start falling behind. They just can't keep up with the rest of their peers. Okay. Yeah, another classic. The first couple of pages, life is wonderful. They can do everything, piece of cake. And then after the first 2 or 3 pages, then trying to get them to read is just like pulling hen's teeth. It's just not there. It's just not there. You just kind of drag it out of them. And it's just not coming. They're getting frustrated. They're seeing what you're going through. There's a mismatch of what's going on. You get very frustrated. Okay. My problem was that I had a problem with reading comprehension. I could sit there and I could read something. I would turn the page. I know I read it, but what did I just read? So let me go back and turn that page again and let me read it again. I'd read it again, turn the page. Gosh, I know I read it. Let me turn back and let's read it again. Turn the page. I have no earthly idea what I read. So when I was in the 3rd grade, I decided I would never read again. It was a waste of my time. Okay? So when history came along and I had to answer the question, how many different kinds of corn did the Hopi Indians grow? Okay. Well, I'd go back through the history book and I look corn. Oh, there it is. Okay. The Hopi Indians grew 7 types of corn. Yeah, I've read the whole chapter. Okay, answer the question. That's all I did. Minimum that I could do is just give up. But you could put anything in front of me and I could read it. You could put collegiate level writing in front of me when I was in the 3rd grade, and I could read it. I had no idea what I was saying, okay, but I could read it, no comprehension. So that's another sign of a visual processing disorder. The one that I hate is if your child has a label, okay? I hate labels, okay? Can't stand them. But we use them all the time, okay? Your child has a disability. Yikes, okay? Your child has a behavior problem, okay? Or your child has attention deficit disorder or attention deficit hyperactivity disorder, okay? And my favorite is dyslexic. Your child is dyslexic. You have a dyslexic child. I hate that word, okay? For Lewisville Independent School District, the definition of dyslexia is a condition in a child with normal to above normal intelligence who comes from a good socioeconomic background, okay, has difficulty reading. That's the definition of dyslexia. That is a broad definition. And in my definition, dyslexia is only a part of that huge umbrella. There's a lot of things that are going on underneath the umbrella. So, any questions for me so far? If you have any question anytime, just holler. I'm very open to that kind of stuff. I'm not a stuffy top person. Okay. Anything yet? Okay. Whoops. Okay. Just a quick thing about eye anatomy. Take my eye, cut it open, look at the halves. This is basically what it would look like. The structures that are most important for our discussion in a few minutes is the lens. And this little thing right here is called the ciliary body. I don't know if you guys can see that or not. That muscle is the muscle that's responsible for changing the power of the lens. Okay? But along with it, the cornea provides 60% of the power of our eye. That's why LASIK surgery works. They flatten the cornea of the eye, which provides 60% of the power. When they flatten it, it gives it less power. So now the image that's out there is able to fall right here on the fovea. Okay, that's an important piece right there, the fovea. That is our area of 20/20 vision. Okay, and so if I'm putting my eye on you, okay, if I'm looking at you, you see nice and clear because that's my 20/20 vision. This young lady right here, I see that she's there. I can't tell anything about her because that's my peripheral vision. Now when I put my eye on her, now I can see her perfectly fine with that beautiful smile. Okay? So fovea is very important. Yeah, blah, blah, blah. Okay. So eye movements. Very simple thing, right? Eye movements. Okay, move my eyes to the right, move to the left, move my up, down, up to the right, up to the left, down, down. Cross them. Okay. Simple thing, right? Yes, it is a simple thing. Okay. However, it is a complicated series of things that occur. You need 3 different cranial nerves. Okay, actual nerves from the brain. Okay, not from the spinal cord, from the brain, to be able to move these 6 muscles of the eye to make it turn up, down, sideways, whatever. Okay, and so this is the cranial nerve 3, major one that does most of the muscles. Cranial nerve 4, superior oblique, very, very thin, tiny cranial nerve. Back of the head. That's why anybody watch MMA sports or boxing? Love it. Okay. No hits to the back of the head. If you hit to the back of the head, there's a possibility that you can sever or break or damage the 4th cranial nerve, and now your eyes will not be able to move correctly. Okay. Lateral rectus. It's the one over here on the side that allows this eye to turn out this way and this eye to turn out this way. Okay. So when we look at these little boogers, to look to the right, the lateral rectus has to work. and the medial rectus has to work. Oh, that's cranial nerve 6, that's cranial nerve 3. Now, if you look to the left, cranial nerve 3, cranial nerve 6. Superior rectus, cranial nerve 3, inferior oblique, that's cranial nerve 3. Inferior, superior rectus, blah, blah, blah. I can go all those stuff. It's very boring, okay? But just know that moving your eyes can be quite complicated. Okay? This is my favorite, okay? However, very important, okay? Because when you go to look at print, your eyes are not straight. Your eyes have to turn in. They have to converge, okay? If they don't converge, you see double. Oh, so maybe could that be a problem with some kids reading, possibly? Because they see double when they look up close? Yes? Yes? Everybody yes? Yes, that makes sense. Okay, good. Okay. So, eye movements are the ability to accurately track with the eyes from one point to another or follow a moving object as it moves across your space without losing it. Okay? So it's kind of like, okay, Johnny, keep your eyes on the ball when you're batting. Okay? Or looking from one word to the next word, or looking from you to you, you to you, you to you. Quick eye movements. Okay? So you have to put your eye on the object to see it. Okay? So if I'm looking at that camera up there, okay, and I'm looking over here, I can see that it's over there, but I have no earthly idea what it's like. So to drop my point here, you look at the T, can you see the Z? Okay, if you look on the second one, you look at the T, can you see the V? Most of us can, okay? But if you look at this T, what's the letter on the end?
No clue.
You can't see it until you move your eye over there. Once you move your eye over there, yeah, now I can see it. Okay? So the periphery of our vision is blurry. Okay? So if the periphery is blurry, what good is it? If I see something move over here, the periphery will catch it. Now I can put my eye on it. I can move my head, or I can move my eye and see exactly what's going on. Okay? So how do we test eye movement? So if you have someone at home, a friend, neighbor, child, aunt, uncle, cousin, whatever, and you want to know, gosh, how well do they do with their eye movements? Very simple. I take a pen, it's usually behind my ear, isn't it?
Yes, always.
Yeah. So don't make it without it. Okay. So you take your pen and you go, watch my pen. And their little eyes should do this. Okay? Real simple, right? You'd be surprised at the children that cannot do that. Okay? And they will go, or they'll go and move their whole body. Very, very immature eye movements. Okay? Can you imagine reading across the line of print? The boy went down the street to the store to buy candy. No. Okay? Very inefficient. So you need to watch out for that. What I use are these two tests right here. King-Devick test. King-Devick test. I'll have them read numbers as it goes across the line of print. This is the demonstration. They'll read numbers as they go across. I will time that. They'll read these numbers without the lines to tell them where they are. And then I'll squish them up really, really good. And time that and compare that to age normals. Okay. This is also a test that can be used on the sidelines for football games. Okay. In spring, you take the football athletes or any athlete, you do the King-Devick test, you make it a contest. The one who has the fastest time wins the prize. Okay. So all these athletes are very competitive. So what are they going to do? They're going to do their best to do the best time that they can on the King-Devick test so they can win the prize. Then when the bell gets rung on the football field, you take out the King-Devick test, you administer the test. If it's 10% slower, do not let them play football any longer. Okay, they have a concussion. Okay, you take them out of the game and let their brains, or their brains, okay, let their brains recuperate from that. Okay, so that's why we use the King-Divic test. I use the developmental eye movement test, and without, not even worry about what I do. But if it's abnormal, I will certainly tell you. Now, the saccades, these movements that we're doing right here, are those movements that you use when you read. Okay. Many people think that when we read, it's a nice smooth movement as we go across the line of print. No. So many saccades, depending upon how much information you can pick up at a time. Okay, I would have maybe 4 or 5 saccades on a line of print. But if you pick up this much information, you might have 10 or 12. Okay, which is more efficient. Me. Okay, 5 or 6, better than 10 or 12. Okay, and that's what we use to find out if you have a problem with smooth pursuit or saccadic eye movements. Okay, so what are signs of deficiency eye movements? You can read them. Child moves their head rather than their eyes. Okay, or they lose their place or skip lines when they read. Okay, how many people still do that? I do. It's normal. Okay. It's normal. We're not perfect, are we? Well, some of y'all are and some of us aren't. Okay. But it's normal to skip or reread a line every once in a while. But if it happens constantly, yeah, that's something we need to check out. Or your child makes careless errors when reading. And what I like is they'll take pronouns from this word and put it on this one, or a suffix and put it on that one. It's just real mixed up, because as they're going across the line of print, they're picking up this information, but their eyes are going to all sorts of places, so they kind of combine things that really aren't there. Okay. And if your child or you personally need to use your finger to keep your place, and you are over 7 years old, you have a problem with your eye movements in reading. Okay? Or if you need to use a ruler, okay, to read a line, yeah, we need to talk. Okay, or if your child is labeled with an attention problem. Now this one, I'm going to get on my soapbox here a little bit. If your child or anyone has a visual processing disorder, for whatever reason, and they're having to sit there in a chair, right? And they have to do all this close-up work constantly, okay? And they're having difficulty doing that. Do you think they want to sit in the chair and do this work all day long? I wouldn't, okay? I'll be looking out the window, see if my friends are out there, okay? Look out the window, see if the bird, look at the whatever, okay? I'm moving around all over the place. Okay, I don't do this. Okay, this is hard for me to do, so I'm going to do this. Okay, I'm going to bother the girl that's sitting next to me. I'm going to put the pigtails in the inkwell or whatever. Okay, yeah, I don't want to sit here and do this. Okay, so sometimes this attention problem is not really an attention problem. It's a visual problem. Okay, so okay, now let me step off the soapbox. Okay. So, let's see. So you're saying, well, this all sounds good, but it doesn't describe me, my child, my nephew, my whatever. Okay. What else could it be? Anything else? Is this all there is to vision? No, there's more to vision than that. Okay. It could be accommodation. Now, accommodation is not those things that we do in the classroom to allow a child to be able to be successful. Okay. At least not for an optometrist, okay? Accommodation is eye focus, okay? Focusing the eye or unfocusing the eye so you can see in the distance, or focusing the eye so you can see up close. That is accommodation for me, okay? Process by which the eye is able to focus on an object onto the retina, by the way, the lens and the ciliary body to achieve a good image. So if you don't focus very well, it's possible that you can read the word "the" when it's really big, but it's blurry. When you're in the 1st and 2nd grade, but when you're in the 3rd grade, and it gets smaller, it's more difficult to read the word the. Okay? So that's why at 3rd grade, specifically, the words get smaller, they get all scrunched up together, and now the child has difficulty reading. Sometimes it's due to a focusing problem. So we relax accommodation, see clear in the distance, we engage accommodation so we can see up close. Okay, so here again, it uses the ciliary body and these little strings or zonules that work on the lens. Okay, so when the ciliary body contracts, it loosens the tension on the zonules and it makes the lens fatter or thicker. And so it goes chunk. So now we can see up close. And then we relax accommodation and the ciliary muscle goes out and then our lens becomes flatter so we can see off in the distance. It's kind of confusing sometimes. Anybody have a question about that? Good. Okay. So, how do I test for accommodation? Well, we take these little bitty letters, teeny letters, okay? 20 letters, very small. We hold them, close an eye. Tell me when the letters start to get blurry. Bring them in towards them. Oh, blurry right there. Good. Tell me when they start to be blurry. Oh, they're blurry right there. Woo. Okay, now we got a problem. This eye was blurry here. This eye was blurry here. Okay, that's a problem. If they're both equal, fine. If they're both way out here, that's probably okay. But in a child, it should always be up here because they have a lot of accommodation that they can have. As the wind blows over our bodies, for lo these 61 years, we lose the ability to be able to focus. Okay, so my near point of amplitude would be like, and I know how to play the trombone. Okay, I can't get quite that far away. Okay, so that's one way to test it. Another way is to test the flexibility. How fast can you go from near to far, near to far, near to far, near to far? Okay, and there's several ways to do it. Look here, look out there. Look here, look out there. Okay, look at your watch, get it clear. Look out there, get that building clear. Look at your watch, look at the second hand, look out there. Okay, and so you should be able to do that pretty well. And this one right here, the maintenance of accommodation, is kind of hard to explain because that's something that I would do as an optometrist during my exam, is to see how well you can maintain that focus and for how long can you maintain it. So a child with a problem with accommodation that's looking at all this worksheet that they have in front of them and they can't maintain focus, okay, constantly in trouble. Too much movement. Lack of focus, truly, eye focus, okay, not mental focus, okay. So when we check flexibility, we have these things called flippers, okay. You guys know what flippers are. You put them up, have words here, put them up on one side, read the words, flip them to the other side. It's an exact opposite lens. There's plus lenses and minus lenses, okay. And we see how fast they can change the focus and see how many times they can do that in a minute. Okay, by reading some small letters, and they read a specified amount. Great, no problem with accommodating or flexibility of accommodation. If they can't do it, and they're reading on one side, they go A, B, C, D, E, F. We got a problem. Okay, you're not able to clear one of the lenses. Okay, so what signs are we looking for? We got a problem with the combination. The reading is really good at first. Reading that first page, they're reading it out loud to you. Bob looked around the park. A man was riding a gray pony. Who wants to ride? Said the man. May I ride? Bob asked his mother. Bob rode the pony around the park. The man took Bob's picture on the pony okay, we have a problem there. Very fluent, all of a sudden, you can, it's not that dramatic, but you can hear a very much slow down in the fluency of the language that they're using. And so it's probably due, it could be due to focus, eye focus, okay? My favorite. Child squirms or moves around when reading. Okay, and why do they do that? Well, if I use this body movement, perhaps I can make my eyes do what they need to do for me to be able to see. Okay, and that's why children are sometimes labeled hyperactive. Okay, this is me. You have to do a book report, so you go to the library, and here's the books you get to choose from. Which is the thinnest book? That's the one that I'm going to read from my book report. Okay? Classic. Very classic. Or if your child complains of headaches or rubs their eyes constantly. Okay? That's because the muscles are just like spasming out. Okay? If you have a muscle spasm, you just kind of need to rub it to relax it. And so that's what we do subconsciously to make that go away. Okay? Questions about this? Okay. Well, they blink excessively to make print clear. Yes, sir.
In the previous slide,
Yes, sir.
about the
The flipper?
flipper.
Yes, sir.
So is that two lenses of one focal point and then two lenses of another focal point?
Of the exact opposite focal point. Yes, sir. So it would be like a +2 lens and a -2 lens. Okay.
So that's making you change your eyeballs focus looking through them?
Yes.
Okay.
Yes. And so I make them so that I know that they are focusing properly. I'll put it on one side and they'll read 2 letters for me on this group of 100 letters. I'll have them read two letters and then they'll flip it to the other side and I'll give them 2 more letters to read, 2 different letters to read. And then I'll just count how many flips they do in a minute. Okay, great question.
But both of them are making your eyes change from what would normally be focused.
That's correct.
Okay.
That's correct. Yeah. We usually do it. So if you came into the clinic, I would have it do you over your glasses.
I see.
Okay. And so it would be +2 over your glasses, then -2 over your glasses. Okay. Thank you. Let's see. Your child complains that things are blurry, even though they have perfect 20/20 eyesight, right? 22 is good, right? Yeah, well, it's good, but it's not the end all. Okay? No, they'll complain that it's blurry. And so you take them to the doctor. The doctor says, yep, got 20/20 vision. Health of their eyes is absolutely perfect. There is nothing wrong with this child's vision. Ooh. There's nothing wrong with the child's eyesight. Okay? There may be a problem with vision. Okay? Oh, yeah. I did this one too. Child holds the book very close and then far away to clear the plant. Start here, end up here. Okay? And then some of us will come back again until it's very, very close. That's another kind of problem. Okay? Or child makes careless errors when reading or copying from the board. Because when they're copying from the board, they have to look up, relax the focus so they can see the letters on the board, and then they have to focus hard in order to be able to see up close. And then they have to relax the focus to see out in the distance, and then focus hard to see up close. And some kiddos can't do that. Okay? Whoops. Yeah, this is my favorite. Little words are misread or confused, but can recognize rhinoceros. Okay? Or elephant, or supercalifragilisticexpialidocious. They never get that one wrong. Okay? But they miss 4. Was, saw, on, in, can, not, whatever. Okay? And reading comprehension is not as good as intelligence. Okay? That's what I get a lot in my clinic. It's smart kids. Very smart kids. Okay? Can't read worth a hoot. Okay? And so, do we classify those children as dumb? No, they're not dumb. They just can't read very well. Okay? I can't sing very well. Does that make me dumb? No, it makes me not a good singer. Okay? I can't play basketball very well. Does that make me dumb? No, I'm not a very good basketball player. Okay? I can ride a bicycle better than you, so does that make you dumb? No, you just don't ride a bicycle as fast as I do. Okay? So, I hate that. Okay? But, that's what children internalize when they're unable to read as well as their peers are in the classroom. Okay? Ooh, I must be dumb because I can't read. Okay? Nothing can be further from the truth. Because these kids are really good at math most of the time. Okay? Excellent at math. They can remember the math problems. They can spat out all the stuff. Easy peasy. Okay? But when you go to word problems with math, you can't do it because they can't read well. Okay? So this doesn't describe my child. Or this doesn't describe my nephew, my aunt, uncle, cousin, whatever. What else could it be? Anything else going on with vision? Yes! Yeah, we got something else going on with vision. It could be eye teaming. Okay? Eye teaming, how many eyes do we have?
2.
Oh, I don't know. Mama's had 4. I got 2 in the front, I got 2 in the back. Okay? The 2 in the back are always 20/20, and they always work extremely well. Okay? But the ones in the front, we have problems with. And so, in order for me to see you, I have to have this eye pointed there and this eye pointed there. But what happens if my eyes point like that? Okay? What happens? I got 2 eyes. Now I see double, right? Because my eyes are pointed like that. Okay? But how many times have you seen somebody with a crossed eye? And you ask them, are you seeing double? No. Only see one. Which eye are you looking at me with? Right? How many times have we said that to somebody? Okay. Okay. Eye teaming, the ability to maintain both eyes pointed at the same object for single vision. Okay. If I'm pointing at the same object, I have double vision. That's not good eye teaming. I have to have single vision. Okay. So if I have the inability to remain both eyes pointed at the same object, it either results in double vision, like this, I'm seeing double, or suppression of vision. This is how people that have an eye that turns in or turns out is able to function in the real world. They only see one, okay? Because their brain says, this is real confusing seeing 2 things. This usually happens when they're knee-high to a grasshopper, okay? This is very confusing to me, so I'm going to do something to get rid of the double image, okay? And so what they do is the brain will suppress the vision in the bad eye, or the amblyopic eye, or lazy eye, or whatever you want to call it. Okay? So, so that's pathological diplopia. And so that's esotropia, eyes are crossed. Exotropia, walls out. Or you can have a convergence insufficiency, where as you're bringing something in like this, you can't do that. It's double. So when a child can't bring their eyes in to see here, it's double. There's double images there. Can you imagine trying to read a line of print with double vision? And the words are squishing together like that. So that's why when they see pony, gray pony in, okay, they might think the word is guinea, okay, G-N-Y-N, okay, because the words push together, okay. And that's why in the next paragraph, if it's ponies in a different sentence, they don't recognize it, okay. So I want everybody to do this. I want everybody to look at me, Take your finger, put it in front of your face like this. Look at me, How many fingers do you see? 1, 2. How many of your fingers do you see? You should see 2. Okay? Why is that? Because your eyes are pointed at me, and so they're not pointed at your finger. So you see 2 of them. That's called physiological diplopia. Whoops. Where is that? This one, right here. Okay? So then if you have your finger in front of me, of yourself like this, and you look at your finger, how many me's do you see? 2. Yeah. Oh, 2 for the price of 1. Okay, very good. Okay. So, convergence insufficiency. Major problem with children that are having problems with reading because they cannot converge their eyes to see one finger right here. So how do we test for that? Watch my pen, bring it in towards their nose like this. They should be able to cross their eyes all the way to their nose and see one pen, okay? If you bring it in like this and they go, whoops, there's two of them right there, okay? Uh-oh, Houston, we have a problem, okay? Because if they're reading at this point or any point closer than that, they're probably seeing double when they read. Can the child tell you, I'm seeing double when I read? No, they don't know. This has been their whole life experience, okay? So you have to test for it in order to find it, okay? It's kind of like high blood pressure. You don't know you have high blood pressure until you check for it. You check for it, you got high blood pressure, ooh, now we do something about it. So if you have convergence insufficiency, you have to test for it. Once you find it, ooh, now we can do something about it. Okay. So objects will appear double when they're close, or one eye will suppress vision because we got double images going on here, right? Very confusing. So I will close, or my brain will turn off the vision to one eye. So now I only see one. Oh yeah, that can function perfectly fine. Very inefficient to use one eye instead of two. So we tested with near point of convergence. I showed you how to do that. So what do you look for at home with your aunt, uncle, child, nephew, niece, whatever? Okay. When they're reading, classic for me, I would put my hand over my face like this so that I would close one eye with my hand. So now I'm only looking with one eye. Okay? Girls, some boys will have hair that goes down in front of their eye, okay, to get rid of the double image. Or they'll look like this while they read. Because now we've got this big thing in front of our vision of the other eye. You can't see the words, okay? And classic is they'll add or remove parts from their words when they're reading because the words double up. And so you get the first part of one word and the last part of the other. Okay? When copying, your child repeats letters within words, okay? Or gets some sort of conglomeration of something in the middle that they don't know what it is. They don't align columns of numbers when they do math. Okay? That's probably a convergence insufficiency. Or the child says the print is blurry. But it might not be blurry, it might actually be double. Because if it does this, okay, that looks blurry. It's actually two. Okay? Or they have any problems with focusing stuff. So strabismus, that's the walleye, cross-eyed, that kind of stuff. Okay? So here's some examples. This kiddo has esotropia, one of the eyes turns in. This teenager has eyes that turn out. That's an exotropia. And this older gentleman right here has a hypertropia, where one eye goes up and the other is not as up as the other. Okay? So, strabismus rarely results in double vision. And so why is that? Okay, we got two eyes that are pointed at two different places. How is it that you're not seeing double? Well, it's possible for the whole eye to suppress vision. Very rare. Very rare. Because the eye that turns in or turns out, if you sneak up on this person on that side where the eye's turning in or out, they can still see you. It's their central vision that the brain will suppress. The peripheral vision, the blurry part of the vision, is still there. So that way if we see movement, now they can move their eye to see what's going on. Okay? So, so if you cross your eyes, anybody here can cross your eyes? Cross them? Do you see double? Of course you do. Okay? If you can't cross your eyes, you can take your finger, put it on your lid, and push, and you will see a double image. Okay? Physically making the eye move up, and so you see double Okay? So how come you didn't suppress that vision? Because the brain is wired not to suppress it. If you're strabismic, your brain is wired to suppress it. Okay. So we've gone over that. Okay. So an eye that turns in or out, many people call that a lazy eye. No, it's a strabismic eye. A lazy eye is when one eye can see 20/20 and the other eye sees 20/50. That's really a lazy eye. And I've seen in the past month 3 kiddos that have come in, never knew that they had problems with one eye because they're using both eyes together. Sorry. They're using both eyes together. When both eyes are working, the dominant eye takes over. I call it the bully eye. Okay? It takes over, it does all of the looking, and the normal eye, which is considered lazy, can't see. Okay? And they never knew. They never knew that was a problem because they were always using both eyes together. So you have amblyopia because one eye has a normal, doesn't need glasses, and the other one is like a +6, okay, or a -6, or a -2 and a +2, or totally different prescriptions. That would be refractive. Strabismic, it's when the eyes turn in or turn out, and God forbid that we have any pathology that's going to keep the eye from seeing at all. Okay. Okay. So when both eyes are open, the bully eye is the one that likes to see. Okay. The bully eye is the one that's out there on the playground doing all the playing. Okay. And the normal eye is out there trying to play, but the bully eye keeps him from playing because he's the one that wants to do all the work. Okay. So the only way to get the normal eye to see is to close the bully eye. Okay. It's kind of like driving. Okay. How old are you?
13.
13. Not a driver yet. Okay. So while you're in the car and you're watching mom and dad drive, okay, you're in the passenger seat. Oh man, this driving stuff is really easy. All you have to do is turn this wheel and step on these little pedals down here. What could be easier than driving, right? And then you remember, everybody, the first time you got behind the wheel of a car, it was almost a disaster, right? Why? You've never driven before. It's a brand new thing for you, right? So you think you were an expert driver when you first started driving? Heck no. Okay? You're pathetic. Okay? But now, I bet you're good drivers. Okay? Why are you good drivers? Practice. Okay? So we have a bully eye and a normal eye. In order to get the normal eye to see, we've got to take the bully eye out. We've got to take you from the passenger side and put you in the driver's seat. Once you're in the driver's seat, now you can learn how to drive. Okay? So, let's see. So how do we do that? We patch an eye. We use binasal tape. So if you ever see anybody with binasal tape, don't laugh at them. They have glasses on, and they have tape right here on their glasses, and that's so that the eyes won't do that. They'll try to look around the tape. Okay? Or they'll have bitemporal tape, like this. Or we can use Wenger occlusion foils. Okay? Technical term to put something over the lens. It's hard for you to see. I can see it. Hard for you to see, but that will decrease the visual acuity of the bully eye. So now the good eye has a chance to be able to see. So if the bully eye is 20/20, the good eye is 20/50. I would put a Wenger foil on this eye to make this eye see 20/60. And this eye sees 20/50, which I am not going to use. I'm going to use the good eye, not the bully eye. Okay, so we can teach that eye to see better. Okay, okay. So that's lazy eye. Okay, I'll explain
So does
that.
that mean you're strengthening the muscles in that one eye?
Not the muscles. We're strengthening the eye-brain connection. Okay, in amblyopia, when we use one eye more than the other, the skills of the eye or the bully eye that we use become very, very good, and the skills of the other eye sometimes are non-existent. Okay, they're not able to use that eye for anything until they close that eye, and now we can start to increase the abilities of that eye to be able to move, fixate, focus, unfocus, focus, unfocus. Okay, that sort of thing. Yes.
So, you know what happens in school
Yes.
when you run the kids through,
Yes.
and it's usually a tech that's running the kids through the
Yes.
audition exams. So I end up with a kid in 3rd grade. For
Yes.
some reason, she's in my clinic. Mom wants me to test her vision.
Yes.
First eye, 20/20.
Yes.
Second eye, and I'm not looking.
Yes.
Okay, read me, blah, blah, blah. Read me the biggie. We got all the way up there. She goes, what biggie?
Yes.
I flipped out.
Yes.
Okay, because her vision had been 20/20 6 months before, and I'm thinking something pathological.
Okay.
So what we figured out she was doing, cover your eye, like this.
Uh-huh.
Okay, so we didn't catch it till 3rd grade.
Yes.
So we read some research, in
Yes.
England that they've been doing,
Yes.
having them patched like
Yes.
this and playing on the computer, certain
Yes.
games that they had in England, we couldn't find them over here.
Yes.
Okay, now this child is in high school.
Yes.
Because it was discovered so late,
Yes.
and they did everything they could,
Mm-hmm.
we now have, a
Yes.
very bad eye.
Yes.
Has anything else come out in the
Yes.
U.S. for treating that? Even
Oh,
somebody,
good yes.
somebody as old as her.
Oh.
I say old, she's in high school.
Oh, that's not old.
Yeah,
Okay.
I know, but
Okay. 43 is not old. 62 is not old.
so
71 is not old.
So there are things for amblyopia now, even
Yes.
at her age.
Oh, good grief, yes. Right?
Yes.
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 Correct?
Yeah.
Yes.
There's two
Yes.
of us therapists
Yeah.
here tonight.
And
Yes.
to my therapist.
Okay, well, we need to talk afterwards.
Yeah. Okay. When I was in optometry school, the literature said that you had to fix this amblyopic or lazy eye by the age of 10.
Mhm.
And if you didn't fix it by the age of 10, then the, what do they call it, the age of development, or I can't remember, it's so antiquated now, but they still teach it
Mhm.
in some schools. But if you don't fix it by the age of 10, it'll never get fixed. Okay? When I was in optometry school, a student who knew absolutely nothing of what I was doing, okay, I had a man, a 35-year-old man, okay, good vision one eye, bad vision the other. He wanted to be on the IV team. In order to be on the IV team, he had to have good eye teaming to be able to be on the IV team, to be efficient, and he didn't have that, okay? And in 16 weeks, I was able to take him from 2100 vision to 20/30 vision, okay? And he's 35 years old, okay? So there's a famous lady out there, Sue Berry. You can look her up and get her book, Fixing My Gaze, I think is the name of her book. She was 42 years old and had 3 strabismus surgeries and wound up with one eye going up like this and the other one nice and straight. Coming in and
Fixing my what?
Fixing My Gaze, G-A-Z-E. Okay.
Thank you.
Okay, so why don't we want the eyes to team together? Any reason for that? Huh? Yes. So we can see clearly, single, and depth perception. Woo! Okay. Yeah. Who needs depth perception? We all do. Anybody drive? Yes, we all need depth perception. So ours have to team pretty well to be able to do that. Okay. So depth perception is the ability of the eyes to spatially locate how far objects are from yourself and from each other. Okay. So that would be catching the ball in the outfield, shooting the hoop in basketball, passing in soccer over to the other side of the field or wherever. Okay. And of course, driving. Okay. Very important. Okay. So I want everybody to do this. Take your fingers, and I want you to put one just slightly in front of the other. Don't put them wide like this. Put them very slightly in front of one another, and close one eye. Can you see that one finger is closer than the other? Really? Can you see the space? How much space is between those fingers? Close the other eye. Oh, it looks different, doesn't it? Okay. Can you see the space in between those? I can't, not really. But gosh, when I put both eyes together, I can see that space in there. That distance, that space, that inches, those, whatever that is, okay? Because I'm taking this image, which is totally different from this image, and my brain is putting them together to form a 3D image of what's going on. Powerful computer that we have here. Okay. Yeah. So it takes the two different images from the right and the left eyes and combines them to perceive depth. Okay. So is this a tunnel? Or is it a pyramid? Can you see both? Yeah. Okay. Well, which one is it? Is it a tunnel or is it a pyramid? Which one is it? How many say tunnel? How many say pyramid? I say it's neither one of them. Okay. It is really two rectangles with lines connecting the corners. That's all it is, right? Right? What makes us see that it's a tunnel or it's a pyramid? The computer between our ears, depth perception. We look at that and we go immediately, what is that like? What is it like? What is it like? Have I seen this before? Yes, I've seen a tunnel that looks like a tunnel. Okay? You've been in an airplane, you've seen the top of a pyramid. Yeah, you said it looks like a pyramid or a chimney or something like that. Okay. Okay. So, all these problems that we have with our visual abilities, the tracking, the focusing, the eye teaming, all of that stuff, eyes turning in, turning out, up, down, whatever. All that stuff can be remediated with vision therapy, okay? And that's what I do at my clinic is vision therapy. Non-surgical, okay? And we can fix this stuff in most cases. Now, I can bring you down the path to the water, okay? But you have to drink the Kool-Aid, okay? We're not guiding that, okay? But you have to drink the Kool-Aid in order for it to work. You have to be involved with it, know what your problem is, and do your best to try to fix it, okay? If you don't do that, then we got a problem. Okay, so it's an individualized program of activities prescribed by a developmental optometrist, okay, which is designed to correct the specific visual needs that or problems that you have, and or improve the visual skills, okay, to retrain the brain to perform quicker, faster, more efficiently, and more automatically, okay? So there are children that can read, the boy went to the store, okay? Is that reading? Technically, it is. I call it barking at words, okay? But once we get the smooth pursuits, the saccades, the focusing, and the eye teaming together, then the child will say, the boy went to the store. Ooh, yeah, because things are more, vision is more automatic. Now we have time to learn, for the brain to be able to learn. Brain neuroplasticity, you've heard of that, okay? How come a stroke patient at 65 loses all the right side of their body? How can that person regain movement in the right side of their body? Brain neuroplasticity, okay? The brain will form new pathways to get to those areas that it needs to be able to move the right side of their body, okay? So we do the same thing with healthy brains, okay, to retrain those neural channels to where they can do things more effectively and get rid of those habitual things that you started, they're not working very well, okay? The more you use it, you'll gain it. The less you use it, you lose it. That's what we want, to lose those bad habits, okay? So how do we do that? We do it with lenses, those flippers that we were talking about, okay? Or we can do it with prisms. We can change the way the light comes into the eye to make you see double. Or if you see double, I can make you see single, okay? Or with occlusion, patching, using the binasal tapes, the foils, and movement, okay? Movement's really, really important. Vestibular movement, balance, okay? We have kids jumping up and down on the trampoline, reading letters on a chart. B, C, D, N, P, Q, R, Z, okay? Vestibular system, oculomotor system, as you know, very, very closely related to one another. So we can use the visual system and movement. We can get the eyes to do a little bit better. Okay? So that's what vision therapy is all about. Okay? These are my two parent organizations. You can look them up on the internet. The Optometric Extension Program Foundation, they're basically the educational wing for where we learn the things that we learn. And that's their URL, or what do you call those?
Website.
Thank you. Okay. And then the College of Optometrists and Vision Development. These people are the ones who certify you as someone who can do vision therapy. I'm not a fellow. I'm an associate of the College of Optometrists and Vision Development. I've had many fellows tell me, get your certification. I'm like, why? Okay, so you can be a fellow. Why? Okay, because you know more about vision therapy than I do, and I'm a fellow. Okay, and I'm just an associate. So you don't have to be a fellow to know all this stuff. And that's the new one, Neuro-Optometric Rehab Association. These people do wonderful work with concussions. Okay, using prisms and lenses to help people with concussions. I know a little about that. Okay, I'm probably the expert in the area, unfortunately. Okay, but I'm learning more.
We've done.
Yes, we have.
We've
Yes.
done great.
We've had a child who was involved in a roper, and the horse fell on him. He was bleeding from his ears, his nose, his mouth, and his eyes. He presented to me after 6 months of therapy with crossed eyes, okay? And now his eyes are straight, he can read, and he passed the STAR test for the first time this past year. Okay, so he did pass, right?
Yes.
Yes, okay. And so we did that with vision therapy also. Okay, so questions, comments, suggestions, or corrections? I'm sorry, I went a little long. Yes, ma'am.
Would you mind speaking just briefly to the retention of primitive reflexes and how you see that
Yes,
and how exciting that is?
yes, it's very exciting. I know enough about primitive reflexes to be very, very dangerous, okay? Primitive reflexes are those things that we have when we are in the womb, which allow us to be birthed, and after we are birthed, to be able to survive outside of the uterus, okay? And there's a whole conglomeration of them, okay? So one of them is the moral reflex. And in the moral reflex, I think my wife has a retained moral reflex because I can jump behind anything and jump out at her and scare her, and she just practically has a nervous breakdown, okay? And that is a positive moral reflex. You test for it by taking the child and you have them backwards, okay? And then you support them, you let them go, and they go like this, because that's what a baby would do, right? Okay? And so if they do that, huge moral reflex. If they go, smaller moral reflex, okay? That's a very basic. And it goes all the way up. One is, when they look back, their knees will buckle, okay? And that is a positive lateral reflex. Another, you ever driving down the freeway? We got lots of people out there with this retained reflex, okay? They're driving down the freeway and they see an accident on the left-hand side, okay? So they're looking over here to the left, and what happens? The car goes to the left. That is a retained asymmetric tonic neck reflex, okay? And there are things that you can do to get rid of those reflexes. I'm not an expert in that. Are you an expert in that?
Probably as much as you are.
Okay. Exactly. There's a book by Sally Goddard that I'm currently reading, which is making me really dangerous with primitive reflexes. And those primitive reflexes are part of the separate stairwell of vision that's going up to the next floor. And they're very closely related to one another. So many times in a good program of vision therapy, okay, we can integrate some of those primitive reflexes, okay? So that they're no longer active. Okay. Yes,
I
ma'am.
have a question. It's sort of a family trait
Sure.
where, like if I go to see a 3D movie, I
Yes.
have to concentrate very hard.
Okay.
It's easier to watch it with, I close one eye
Yes.
and then I can see it, but it's like, but what's the point of this? And so I kind of concentrate so that it will converge and then I can watch it as a 3D movie. So
Yes.
there's really not. My mom could never do that. So, you know, the viewfinder,
Mm-hmm.
she had closed her eye.
Okay.
The viewfinder. So what
Yes.
was, and we do a lot of so-called lazy eye in our family.
Okay.
So I don't know what that
That would
relates
be
to.
an eye teaming issue, getting both eyes to work together at the same
So that's
time.
like a common trait of, I guess.
And many of these things that occur on down the genetic line they're genetic. Okay, they're passed in from one generation to the other.
And because I know also it's a family trait, like
Yes.
images that, like the NTB, I think they're crunchy, but I saw that as a cup for years. I didn't see it as the way they wanted you to see it. I saw it as a cup, you know, the Batman image, I saw it as jaw.
Okay.
You know, and that was, and our son's the same way. My husband kind of, he's used to me seeing things backwards, so he can do it now. But, you know, it didn't affect our ability to read it or anything.
Right. Right.
It's just
Yes.
quirky.
Yes. Quirky is a very good answer for that. Yes. Can you survive with that? Yes, you can. Yes, you can. You're probably suppressing central vision.
Well, what I find now when I'm tired, I see double.
Okay.
It's kind of fun. So,
Yeah.
you know, watch two images on the TV. I'm like,
Yes.
wait a minute.
Yes.
There's not supposed to be two images.
There was
Okay, now I see one.
a baseball player, probably about 20 years ago, who had exotropia, one eye went out, okay? And he was the league's best second base stealer, okay? He was wonderful at it. Why? He could put one eye on the pitcher and put one eye on
Right.
and he could see both of those images. And so as he's ready to go, he didn't have to turn to look at the picture. He just had to look at the second base. He could see the picture over here.
So is there any concern with that, or is it just something that I just, because I think it's sort of age-related at this point where when I'm tired, I'll see.
Well, in my humble but accurate opinion, I think that can be fixed. Okay? Okay. If you want it to be fixed. And if you don't want it to be fixed, you're perfectly able to live your life the way you want to. I don't want to interfere with that. Okay? Because you're going to have to learn something totally new and different.
Hmm.
And it feels different. Okay? It's not relaxed the way it is right now. Okay? You might have to work in order to be able to get
Yeah, because my concern is if I'm very tired when I'm driving, I have to close an eye now.
Yeah. Okay.
And that you're not really getting the depth perception.
No, you're not
And
getting
I
depth
have
perception.
very good depth perception when both eyes are
Yeah.
in here, but
Yeah.
when one,
Very
but
common.
I've
Very
done
common
that.
when you're
I've
tired.
had to not, you know, literally just close
Yes.
one eye while I drive.
Very common when
And
you're
I-
tired.
And that's just the last couple of years.
Because when you're fresh, you can get those. You can make those eyes do whatever it is you want to do. But after a while, they get tired. Okay. I can hold 10 pounds out like this for a pretty long time, but I can't do it all day long.
So it's something that even at this point I could strengthen so
You
that,
could. Yes.
because genetically my eyes suck, and so I will not do anything before it's time.
Yeah, that's possible. Mhm.
Okay.
Question.
Okay, quick question.
Yes, ma'am.
Just yes or no's or whatever.
Okay.
Okay, so people see you,
Yes.
they're referred from an optometrist or an ophthalmologist, correct?
Optometrist, ophthalmologist, psychologist, psychiatrist,
Etc.
occupational
But you're
therapist.
considered a specialist. Usually when
Internet.
people are referred to you,
Yes.
not just a parent coming to you.
A parent can come to me if they want to.
Okay.
Yes.
What's the youngest age that you can start testing?
Testing.
Or,
I
or
can
no
test at 3. Okay.
Uh-huh.
I don't want to do vision therapy until they're 5 or 6. They have to be able to understand my instructions and be able to act on my instructions. Okay.
Okay.
It's possible to do things in the home while they're 3 years old to develop 2-eye vision. Okay. If an eye goes in or out, there are things that can be done at home to try to foster
Until they
that.
get older. Okay.
Yes.
Do you have a questionnaire for teachers or school nurses?
Uh-huh.
Simple. Like they always have the commerce. Do you have something for vision?
Yes, I have a quality of life checklist. Yes.
Okay, I'll get that down later.
Okay.
And then, so an adult, let's say an
Yes.
adult had a tumor near the trigeminal, removed,
Right.
has trouble with their vision after,
Yes.
you can help. Maybe, perhaps.
Perhaps. Yes.
I think you answered everything. Oh, nope, last two.
Okay.
Okay, we're getting older, so,
Yes.
are
no, the wind is blowing over
over
your
our
body.
body. Okay, I'll remember that. I'll remember that. Eye exercises
Yes.
as we age, is that something that we could come to you for if we have, yes, it looks like I have great vision, but my vision, I wear trifocal contacts. So, is there something that we can come to you for?
I cannot do anything to help you with your focusing so you can get out of the trifocals.
No, but I mean to maintain, we do exercises to remain strong.
Yes.
Is there,
Okay, I get you. There are things that can be done, but if you read at all, you're using everything that I need you to be able to use. Okay. And so you probably do not need to have any supplemental exercises.
Okay. What about,
unless you're experiencing a problem.
Okay. What about supplemental vitamins? And that's my last question.
Okay. That's a whole different topic. But two substances, lutein and zeaxanthin, have shown to be really, really important. zeaxanthin. And lutein, lutein, are very important. Vitamin A is an important part of rhodopsin to allow your eyes to work properly. And I am just an overall proponent of any antioxidants. Okay, vitamin A, C, E, fish oil, D3. Those micronutrients, you know them better than I do, Dr. Brian. Okay.
So Vita Eyes, does that kind of cover
Vita
everything?
Eyes is good.
Any other?
Personally, I use Centrum Silver.
Really? That has it
Silver.
all. Yeah.
Okay. Has a good high antioxidant profile.
What about zinc? Because I know my
I'm sorry?
mom's eye doctor was really, she had a special formula and she really stressed zinc.
Yes.
As well as all the
And
other.
zinc, that's one of those micronutrients. Yeah, zinc's very important. It's a nice antioxidant. People that have macular degeneration, they want them to take Preservision or yeah, the other one. It's the exact same profiles, both made by Bausch and Lomb. They just put two different labels on it. Preservision and Opti. What? Optiflex? I don't think that's it. Something. Exact same formula, both made by Bausch and Lomb. They just put different labels on it.
So is, are we saying macular? Are they saying, the research is saying that there is a genetic
Yes.
predisposition?
Yes.
So would it behoove people then to go ahead and maybe start on this now before you develop it?
It does. I can answer for my mom.
Yes. Yes. If you have a genetic predisposition for macular degeneration, then at some point you will develop macular degeneration. If you take high antioxidants or Preservision or it's right there. If you take that, then if you're genetically predisposed to get it at age 60, then you probably might not get it until you're 65, but you're still going to get it. Okay? So your age from 60 to 65 is more useful because you don't have macular degeneration. Okay? And when you take it, if you get the macular degeneration, it does not go immediately to its endpoint. Okay? It takes longer to get to the endpoint. So if you're genetically predisposed to get it at 60, and it's going to finish at 62 and you're blind, okay, but you take the antioxidants, and you don't get it until you're 65, and it takes until you're 75 before it comes to its conclusion, well, you have 15 more years of good vision that you can use.
And both wet and dry, they're saying are.
No, totally different.
Okay.
Dry, there's no cure for that. Okay, wet, they can actually do shots and put
But
it
I
in your
know, I
eye.
mean, as far as being genetic,
Oh,
both wet and dry.
yes, they're both genetic. Yes, ma'am. Okay. Yes.
I have two quick things.
Yes.
So all of these eye movements that you've personally done this
Yes.
evening, if I did all of those, I would have a tremendous headache.
Really?
Yes.
Okay.
So is that a vision issue or more of a physiological issue of some kind?
It could be one or the other or both.
Oh, okay.
Yeah, it just depends.
So not
Okay.
normal. Usually.
It's not normal. You should be able to move your eyes separate from your body in all sorts of different directions. Okay?
Well, I can do it. It's just it gives me a headache.
Yes. Okay. And so, where does your headache hurt? Okay. And do you get that every day?
No, just only if I do a lot of eye movements like that.
Such as working on a computer,
Not necessarily.
reading.
Sometimes. Tablet,
Okay. Driving.
if I'm tired.
Okay. Do you take anything for your headache?
Not daily, no.
Okay. When you get a headache, do you ever take anything for it? No. Okay. If it's severe, will you take something for it?
Yes,
What do you take then?
it's a migraine medicine.
Migraine medicine. Okay. Okay. It still depends.
Okay, that's
It still
fine. I
depends.
just wanted to kind of get a general idea of it.
Yeah. You should be able to move your eyes separate from your body and it not cause any problems whatsoever.
Okay.
Okay.
And then
Do you see double when you do that?
And then do you have an opinion on screens, video games?
Yes.
A short opinion.
No. Yeah. I don't know about you guys, but when I was a kid, my mother kicked me out of the house after I ate breakfast, and I had to be back when the lights came on the streets, on the street lights came on, okay? And if I wasn't home when the street lights came on, I was in big trouble, okay? So what did I do while I was out and about? I climbed trees. I fell out of trees. I broke my finger. I rode a bicycle. I played in the stream. I hit snakes with a stick. I fought with my neighbor. I
I'm
did
going
all
to
sorts of
assume
things.
all of us did that except for this guy.
Mhm.
Kind of looking around the room.
Exactly.
I mean, he's in sports. He's an active kid. He
Good.
just likes his video games. So
Yes.
is it a bad thing?
Well, here again, it depends, okay? You are looking at a two-dimensional object and you're gathering three-dimension information out of it, okay? And that's not normal, okay? 3D information is this stuff. Looking and seeing, directing action so I can shake your hand, okay? Or so I can kick you in the shin, okay? Or whatever. That's what vision is designed for movement. So when you're sitting there, that's not movement, okay? So to visually develop, I think you need movement more than video games, okay? But if he's doing sports, that's probably sufficient. Okay, does that answer your question?
Somewhat.
Somewhat?
Yeah. Well, I mean, would you have
Are
a limit?
Yeah, specific.
Yeah, I would put a limit on it. Mhm. Yeah, for vision development, okay? But he seems to be a smart kid, okay? Make A's in school? Yes, okay? Okay? Doing well in school? Doing well in sports? You know what? There are things that I like to do for leisure, okay? That my wife hates for me to do. But you know what? It's my leisure. I get to do whatever I want to. So I'll sit there and I'll cut fabric for a quilt, okay? Drives her insane, okay? But that's what I like to do for leisure. That's what you like to do for leisure? Rewarding for that. Okay? Starts making D's in school? Yeah? Study more, play less. Okay? It's a parent thing.
Well, but I was asking more for the brain development thing.
Brain development?
Yeah. More along that issue.
I think reading will give you more brain development than any game could ever do. Yeah.
Okay.
Yeah. Good. Yes, sir.
So where does your practice fall in the insurance world of thing?
Excellent question. Now, insurance companies are specifically excluding vision therapy as a covered medical practice. Okay? This is a battle between ODs, optometrists, and ophthalmologists, or medicine. Okay? Insurance companies are dictated by the medical community, okay, and they follow whatever the medical community says, okay. So if I were an ophthalmologist, I would say, oh yeah, that Fred Brecheen, he's selling snake oil, okay, he's a quack, okay, because I can fix strabismus with a surgery, okay, and they can fix strabismus with a surgery. They can get a cosmetic alignment of the two eyes, but the underlying problem that caused the eye to go in or out is not fixed because they've not developed the eye-brain connection, okay? And many times if you have one strabismus surgery, then the eye will either go out or in after the surgery. And then if you have the second surgery, first of all, if you have the first surgery, you have a 50% chance of needing a second surgery. If you have the second surgery, there's a 75% chance you need the third surgery. If you have the third surgery, just might as well know that you're going to need a fourth surgery, but by that time you're like, this isn't fixing things, I got to do something else.
So is that a newer philosophy, or is just that we didn't use as much insurance? Because, I've already mentioned the lazy eye syndrome in my family. I didn't have any of that, but a lot of my cousins did.
Mm-hmm.
And they're all my age range, which is, we're all in our 50s or 60s.
Mm-hmm.
So it was no big deal. My cousins had to wear an eye patch when they were at home,
Right.
drain the eye, they're fine.
Yes.
So, but did that because you just went to your ophthalmologist and he said, they're lazy eye, let's just make them wear an eye patch when they're at home so they don't get teased at school.
Mm-hmm.
And it's fixed. But is that now that the trend is that we have much stricter dictates, or is it just?
It depends upon the condition, okay? Many times you can put an eye patch on and it will fix some things.
Because that was sort of like what they would have done in the 60s.
Yeah. But sometimes, I don't know about you, but if I have 20/20 vision in this eye and I have 20/80 vision in this eye, and you make me patch this eye and I have to look with this eye for 8 hours a day.
What I have some of my students have that situation, and their glasses are forcing it.
Yes.
So it's not apparent, but
Right.
I have a couple of my students, my brother, sister, that I teach piano to, have told me that their glasses are because they had the one eye that was so much more dominant. So that's how they're fixing it. So again, it's not a surgery.
Right.
And
Right.
both of their parents are doctors, so
Right.
but it's not harming them as far as doing anything
Yep.
drastic.
Yep.
It's
Not
just
harming them
fixing
at all.
it by their glasses causing to do the correction.
Now, how far up the stairwell they are, I have no earthly idea.
Yeah, I know.
Yeah.
They're my best piano students, so they're
Okay.
doing okay.
Oh, they probably are. Okay. Yeah. Yes, ma'am.
I just had a few questions regarding some of your younger patients.
Yes.
Have you had any who were chronic bedwetters who you've seen have improvement or resolution with vision therapy?
There was a word in there that I misunderstood.
Chronic bedwetters?
Chronic bedwetters.
Yes.
Yes, chronic bedwetters usually have a positive spinal galant, primitive reflex. Okay, these are kids, none of who are in here, so when their backs touch the back of a chair, they start doing this. Okay, it's a primitive reflex from birth as their lumbar region touches the vaginal walls, they squirm so that they can come out of the uterus. That's what the primitive reflex is, okay? And many times a child that is a bedwetter has a positive spinal galant, okay? Yes, that can be fixed in vision therapy. I'm not for sure exactly what it is because I know enough about primitive reflexes to be very dangerous.
Okay.
Okay.
Are there any eye exercises that you may know of off the top of your head that could help with strengthening bladder muscles?
Not that I can think of right. That I'm still in the learning process for that.
Okay, can I say, let me say something about chronic bedwetting?
Mhm.
They ought to be tested for sleep apnea.
I'm sorry.
Sleep apnea for children, even children of bedwetters. That is, more and more is becoming known about that. I know a couple who were diagnosed with sleep apnea. They had no idea. And when that was corrected, bedwetting went away.
Sleep apnea is also associated with inattention.
Mm-hmm.
Okay.
Yes, that's another one.
And so
There's a doctor in Flower Mound that is all over this with kids, Dr. Krish, and she's absolutely on having children, with ADD. Definitely have your eyes examined because that's really easy.
Yeah.
But if that's not the issue, look at sleep apnea for the ADD and bedwetting.
cool.
It's really interesting. Thank you.
Okay. Occupy. Thank you.
Oh, yeah.
Preservation.
Yeah.
Occupy. Yes. Someone wanted me to talk about Erlin scotopic sensitivity. Okay, that is where you use the color filters to put over reading material, and now all of a sudden the child can read. I went to a seminar, psychology seminar, and there was a lady there that was talking about Erlin syndrome. She would practice over here in Plano, and so I got to talk to her after that was over. And so we went over some of the scientific literature about all that. And there is a test, it's called, it's a P100. And when you're presented, when the eye is presented with a stimulus, the image goes to the retina, it goes to the brain, and then at 100 milliseconds later, you get this peak in the copper cortex where vision takes place. It's called a P100. And so you present the image, and 100 milliseconds later, you get this spike. Okay? And so she showed with her scientific evidence that when a child would read without it, they would have a very low P100. You put the correct filter in place, bling, you get this real huge P100. And I'm like, ooh, yeah, this is good stuff. Now, I'm interested in this because this is what we do, okay? And this is how we can get children that have no verbal skills or refuse to talk to you. If you just keep their eyes open, we can do a refraction using the P100. So I do not have that specialized equipment, okay? But, so we're really interested in it. So we talked, and I said, okay, so what happens when you take the color filter away? Get a small P100, okay? So I showed her the evidence of children with like convergence insufficiency or whatever, having troubles reading. Beginning of therapy, they have a very low P100. After therapy, a high P100, which stays with them for the rest of their life. A child with Erlin syndrome, you put the color filter in place, boom, yes, you get the high P100, you take the filter away, low P100, okay? So this vision therapy affects the whole neural transmission that goes on. Not really for sure how the color filters work, but they do work. Okay, so that's something you can use to help you over the hump. Yeah, I don't have a problem with you using that. You can put it in your glasses or you can use a filter. But once you take that away, the problem still exists. Okay.
It was recommended for him to get that blue on
Yes.
his glasses for
Mhm.
video gaming.
Mm-hmm.
Does it help?
It's a anti-blue. Okay, I have it in my glasses also. There's new studies that are coming out that with all the use of TVs, computer monitors, iPads, iPhones, you're getting a lot of blue light. Okay, and blue light is close to the ultraviolet light, and sometimes we do get ultraviolet from these things. And that upsets our circadian rhythm, okay? Because the good Lord made it so that when the sun goes down, we're no longer exposed to ultraviolet light. When we're no longer exposed to ultraviolet light, then we get tired and we get sleepy, okay? And so we go to sleep. But in our modern age, when we're looking at this blue light all the time, okay, and my wife is one of them. She's a medical transcriptionist, okay? She's on the computer all day. And when it's time for her to go to bed, she flips and flops in the bed like a wild fish. Okay? So I got her some blue blockers, okay, that reflect the blue light out, okay? She wears those while she's at work, and when she gets tired, she takes them off, she goes to bed, she sleeps like a log.
Is that something you just find? My husband's a video editor, and he's always been a good sleeper, and he's always editing, and he can't sleep anymore.
Right.
And
Get blue blockers.
so is that just, would you go to like someone who or just regular? How,
You can
what
go
would you do?
to any eye doctor that you
And
want to.
just get, because
Yes,
that probably would help him, because
yes.
I've never been a sleeper, but that's my disposition. But he's always been like, you know, he could sleep
Don't
forever.
get
He
the
can't
yellow
sleep
lens.
anymore.
Don't get the yellow lens.
Okay,
That
but
will
get the
absorb
blue-
the blue,
the
the
other
shrunk
one.
ones that
So
will
what
reflect the
and
blue
would
light.
he been wearing? Because he's in front of the computer for hours,
Yeah.
and he can't sleep anymore.
Right.
Okay.
And that should help. I'm sorry?
So I have the yellow ones.
You have the yellow ones?
That's you.
Okay. Well, it does absorb the blue, okay, but with the coating, it will reflect all the blue and the ultraviolet. Get it away.
So if the yellow's like for driving at night, when you know that's another page thing where suddenly it's like I can't see.
The yellow
It's
lenses
really the
do
glare
work.
that's an issue.
They do work. Stops the blue light. Of course, white light has red, yellow, orange, green, blue, indigo, violet. Okay, and the blue light. When we take the blue light away, it's easier to focus the longer wavelengths of light than it is the shorter wavelengths.
So for driving at night, what kind of
Yellow's good.
yellow
Yellow's
would
good.
that be the best color to choose for
But-
that? Or
You have difficulty seeing blue when you wear the yellow lenses.
yeah.
Okay. So he's out on a blue shirt. Still blue. Okay.
You don't have to
If I'm
drive at
yellow-
night frequently and it's starting to be
Yeah.
wrong.
If I'm on a real different yellow, the shirt might look more black. Okay, so it can affect your color vision a little bit. Not a lot, but a little bit. Okay. Anything else? Thank you very much. I've spent way too much time with you guys. This is me. Okay, that's my website. That's my phone number. If you have any questions at any time, please give me a call. That's what I'm there for. Okay, I'll give you free advice over the phone. Okay.
I'll just say, I met my kids who graduated from this vision program, and two of them had convergence and deficiency, and one, well, we always called it a lazy eye, I guess,
Yes,
not technically,
yes.
but I was going out, I was told by two ophthalmologists, surgery was the only answer, and in 3 months, her eyes totally straight, and has never had another problem. So, I would just say we've had that.
It works.
It works.
It works.
Yep.
Okay, thank you very much. If you have any questions, I'm right here. Need some brochures or anything? Right here. Okay. Thanks again. Oh, yeah, everybody have a ticket and a drawing?
Oh no, yes, so.
I have non-prescription polarized sunglasses for whoever is the lucky winner.
But not blue block.
Ticket.